So today, we're going to open up the playbook, the one used to stop one of the world's deadliest viruses, literally in its tracks. We're going to look at the step-by-step, coordinated response to a Marburg virus outbreak. And believe it or not, it all starts with just a single case. I mean, it's a terrifying question, right? You've got a virus with a fatality rate that can be as high as 88%, and it suddenly appears in a community. Panic, well, that can set in really, really fast. So how do public health officials actually get ahead of it? How do they stop a catastrophe before it even has a chance to begin? You know, every single major outbreak starts just like this, with one case, a single spark. But here's the thing, that spark doesn't have to turn into a raging wildfire. A fast, coordinated, and most importantly, scientific response can contain it. And that's exactly what we're going to walk through right now. Okay, so the absolute first priority is to stop the virus from jumping from one person to the next. This is all about the immediate, urgent moves that have to happen the second a case is even suspected. And really, it all comes down to these 4 critical actions. Think of them as the foundational building blocks of outbreak control. They have to happen fast, and they pretty much have to happen all at once. So what are they looking for? Well, a high fever, a really severe headache, bleeding. These are the first alarm bells that start ringing. In an area that's considered high risk, health workers are trained to immediately think Marburg. They'll collect blood samples for lab confirmation right away, often using a PCR test, which is basically a super fast genetic search for the virus. Getting that definitive yes or no as quickly as possible is everything. It's what stops the silent spread. The moment a case is even suspected, we're talking before it's even confirmed, that patient is moved to a dedicated isolation ward. This is completely non-negotiable. It creates a physical barrier between the virus and everybody else in the hospital and the community. Of course, health workers gear up in full PPE because protecting them is absolutely paramount. And then the detective work begins. And the scale of this is just staggering. Teams start tracing every single person the patient might have had contact with. And we're not just talking about close family here. We're talking about the taxi driver who brought them to the clinic, the first nurse who saw them, the neighbor they had a chat with yesterday. Literally everyone. And this number, this is the key to the whole operation. 21 days. Why? Because that's the maximum known incubation period for Marburg. So for 3 full weeks, every single one of those contacts is monitored, every single day. If someone makes it to day 22 with no symptoms, great, they're in the clear. But if anyone gets sick, they are immediately isolated, and guess what? A brand new 21-day clock starts for all of their contacts. It's a massive effort, but it's an incredibly effective way to be sure that the chain of transmission has been broken. But listen, contact tracing and isolation, that's only half the battle. You can't fight a virus like this with just doctors and nurses. You need the entire community to become part of the solution. This is how you build a human firewall against the outbreak. And that firewall is built on one thing: trust. Now, this is one of the most difficult, but also one of the most critical parts of the response. The Marburg virus stays highly infectious even after a person has died. So traditional burials, which often involve family washing and touching the body, can accidentally become these super spreader events. The solution is to introduce what are called safe and dignified burials. These are done by trained teams in full protective gear. It's done with immense cultural respect, allowing families to grieve and pay their respects from a safe distance while breaking a major chain of transmission. And, of course, none of this works without clear, constant, and trusted communication. Public health teams have to work with local leaders. They get on the radio, they're in community centers, using every single channel they can to get the facts out there. This isn't about creating fear. It's about empowering people with the knowledge they need to protect themselves and their loved ones. Okay, so you've contained the human spread, you've engaged the community, the immediate fire is out. But the job isn't done yet. The final part of this playbook is all about making sure the whole system is stronger for the next time. What's absolutely crucial here is recognizing that hospitals can either be places of healing or, unfortunately, places of amplification. So strict infection prevention and control, or IPC, becomes the new standard. This means PPE for all staff, rigorous disinfection routines, proper waste management. You have to protect your healthcare workers at all costs. And to stop future sparks from ever happening, you have to look beyond just people. This is where a concept called One Health comes in. And it's actually a really simple but powerful idea. You can't protect human health without also protecting animal health and the health of the environment that we all share. They're all connected. So what does that actually look like in practice? Well, scientists literally go to the source.
They'll investigate caves and mines where fruit bats, the virus's natural reservoir, live. They study how the virus might jump from wildlife to humans. It's all about understanding that connection to help predict and hopefully prevent future spillovers.
And you have to remember, no country has to fight this alone. When an outbreak like this hits, it's a global concern. International partners like the WHO and the Africa CDC mobilized immediately. They deploy mobile labs for rapid on-site diagnosis, they send expert investigators, and they ship in plane loads of vital supplies like PPE. So even after the last case is cleared and that final 21-day countdown's over, the work still continues. This is about building a lasting legacy of preparedness. It means better surveillance systems to catch the next case even earlier, more training for health workers, and making sure the community stays informed. It's about turning the painful lessons of a crisis into permanent defenses. So there you have it. It's not one single magic bullet, but a 3-layered defense. It starts with the swift, scientific management of individual cases. It then expands to building trust and cooperation within the entire community. And it ends with strengthening the whole health system for the long haul. We know the playbook. We've seen that it works. But outbreaks of diseases like Marburg, well, they're not really a question of if, but when. So the crucial question this leaves us with is, how do we make sure this level of preparedness is the standard everywhere, ready for that next spark, wherever in the world it might appear?